Welcome to episode 5 of Empowered Voices, advocating for yourself, how to partner in your own care. We hope that in this episode of Empowering Voices that we will explain about self-advocacy in healthcare systems, particularly for our mothers or individuals navigating the complexities of recovery from opioid, stimulant, and substance use during pregnancy and postpartum. Our goal is to equip our listeners with the knowledge and confidence needed to take an active role in their care and decision-making processes.
Yeah, excited to be here. We'll do a little bit of introduction. So I'm Dr. Farzad Kamyar, a physician specializing in psychiatry and addiction medicine. And my co-host, Amani Wilson. Yeah, who I think my intro for you, Amani, is usually you're jack of all trades, have a bunch of different specialties, and know a bunch of stuff. We have 2 guests with us today. I'll intro them in a little bit. But yes, so why do I think that this is important? Advocating for yourself. What's the one-liner? Because maybe no one else will.
Exactly.
How about that? Because maybe no one else will.
You know, okay. I got to say my famous line that my grandpa used to always say, baby don't cry, baby don't get no milk. It's so true.
Yes. No, I love it. Okay, so jumping in, let me do some introductions. We have with us Miss Evonne Hernandez.
Woo, welcome, Miss Evonne Hernandez.
Evonne is our program care manager at the Empowered program. And then joining her and us is Miss Sam.
Hi, Sam. Woo.
Yeah, and Sam is one of our peer recovery support specialists. Can you guys introduce yourselves a little bit? Start off with you, Sam.
Oh, okay.
Yeah.
Yes, my name is Sam. I am a peer recovery support specialist over at Empowered. I am also in long-term recovery. I am a mother. Yeah, that's it. I know there's more, but I can't think right now.
There's
all right.
more folks.
And I'm happy to be here. Thank you.
It's not at all.
Thank you.
Yes.
Well, like Dr. Farzad said, I am program care manager for the Empowered program. We love working with our ladies. I work alongside with Sam, and we help them navigate, the community resources. My name's Evonne.
Yeah.
Can I say that?
Yeah, of course. Again, thanks for being here.
Yes.
To get our conversation started.
I'm going to be honest.
Yeah.
Evonne does exactly what this title is.
That's right.
She truly, both Evonne and Sam, they do exactly. They teach our clients how to truly advocate for themselves.
Yeah, and that's sort of a recurring theme that we're trying to go for this podcast is that ideally our guests are sort of pertinent to the topic at hand. And for today, it is about advocacy. So why don't you start off our viewers and listeners? Let's go with Evonne. Just what are some basic principles? Like what are the pillars of self-advocacy?
Well, I first want to kind of define what self-advocacy is, and I think it's just the ability to understand and to communicate one's needs, preferences, expectations, and I think it's something very important for our patients and for individuals, especially those in recovering and confidently navigating the healthcare systems and other community partners. And I'm going to say a lot. I think that's definitely what is clearly showing up right now. And, so some of the principles I'd say would be to do a little bit of the research before going out and writing down your questions.
Excellent.
If it's something concerning, let's say, medicated assisted treatment, you may want to write down some of the symptoms, some of your history, kind of know what you're going in and what treatment you're seeking. I know I have a little bit of a story with some of the patients, two in particular, both needing a medicated assisted treatment and one doing just a little more research than the other. So she was clear on what she wanted. It wasn't methadone, it was buprenorphine. Versus the other patient, she did not do any research or understand what treatments were really available to her. So she complied and just accepted the first treatment that she thought was the ideal treatment. And just the effects and the impacts were completely different, and the outcomes were completely different for each of the patients.
Imagine.
Yeah.
Sam.
She stole mine.
She stole
She
yours.
stole mine. I was gonna say definitely do your research. I feel like that's super important because as a client or as a patient, you obviously don't know as much as the healthcare provider that you're seeing.
Yes.
And you want to know at least a little bit about your diagnosis before you go in and get nervous to ask questions, or just there's so many things that you could do, but she definitely stole mine. So thank you.
And write them down. We can't rely purely on memory.
Yeah.
And I remind my patients this all the time, and the participants of the program and myself. I go in with my little list, and I'm kind of right now concerned that I don't have my little pointers right now, because I know I'll forget of what really I wanted to discuss. But going into these, meeting with providers, have your questions ready. Make sure it's okay to take your time. Make sure to clarify. Not only you're asking the questions, but you're asking the questions and asking them that they explain it in a way that you can understand that information.
That's super smart. And also, I have to piggyback on you saying, especially because we are speaking to pregnant mothers, and a lot of us pregnant mothers have pregnancy brain. So you do really want to make sure you write down these questions.
And even after, we got that mommy brain.
That part right there is so true.
Yeah, so you all both bring up really good points. One I want to hit on is, first, you stole what I wanted to say. So, just kidding. Okay, so you talked about doing your research, right? And I would say amongst the healthcare community, there may have been, over the past several years, this notion that, patients have access to kind of the world at their fingertips, a la the internet and Google. Web searches. Yes, web searches. So I actually take a stand, and there's like stigma associated with that. Don't do it. You're going to over this and over that and get worried. And those things absolutely could be true, right? I sort of take the approach with my patients in that, amazing. So you've done some research. Let's talk about it. Okay. That's from the clinician side. Okay. But from the patient perspective, when you do your research, as everyone here has recommended, try to stick to sort of vetted sources.
Yes.
Okay. What I mean by that is if you do a web search and it comes up with a website that's like, substance use treatment sucks and everyone that's an addict is a horrible person. .com, .death, .go die.
Oh, wow.
Let's not go there.
Yeah,
That
like
part, I
I would
love
say
it.
skip to the next resource, right?
Yes.
There's
You
a
want something
plethora.
credible.
There's a lot of resources out there that are highly vetted. Things like, the Substance Abuse and Mental Health Services Administration, what we
Yeah.
call
SAMHSA.
SAMHSA for short. You could probably find everything that you need from SAMHSA, especially when we're talking about substance use. It's called the Substance Abuse, right? Mental Health
Yes.
Administration. So that's a great place to start because it is absolutely so important to know. Piggybacking off of your example, Evonne, I do a lot of advocacy and education regarding best practices for clinicians. And particularly, you mentioned 2 medications. When it comes to opioid use disorder, this is 2024, okay, we currently have 3 approved medications. We have methadone, buprenorphine, and naltrexone. Buprenorphine and naltrexone are newer to our toolkit, let's say within the past couple decades, okay? Methadone has been around for decades. But unfortunately, what I've seen happen in our communities is that that's the way people have been doing things, that's the way they are doing things, and that's the way they will continue to do things.
That push for
And I am not basically saying that one medication is better than another per se, asterisk, caveat. However, our data shows, remember, I'm sort of sticking to evidence-based, best practice, standards of care, recommendations. When it comes to pregnant individuals, there is a clear winner. No ifs, ands, or buts about it. buprenorphine is a superior medication during pregnancy
Absolutely.
than methadone. And I have seen unjust practices happen where patients are never informed of their other options. It is methadone is the only. Methadone is the gold standard. Methadone is the best. Methadone is recommended during pregnancy. There other medications don't. You name it. And I've seen this both among patients and among clinicians, including specialty addiction treatment centers. That is an injustice that we're doing, but if patients can ideally do a little bit of research and go in with that in hands, whoa. Because from a neonatal abstinence perspective and your growing baby, buprenorphine absolutely has better outcomes than methadone. So that was kind of a push for buprenorphine in our pregnant and postpartum individuals and those of reproductive
Love
age.
it.
I think
Absolutely.
just understand that there's alternatives.
Yes.
You know, and almost any medication.
Yes.
So go in there and ask your questions and ask, hey, is there anything else? Is there another option?
Mm-hmm.
You know,
There
they're backing
always
on
is.
that.
There's
There
gotta be.
always is.
Yes.
Yeah, and like I mentioned, 2024, if we had this conversation in 2030, in 2035, people might look back on this podcast and be like, that idiot clinician was talking about buprenorphine and methadone.
And we
How horrible are those
we have all these
medications?
other treatments.
All these ones that have amazing outcomes. Baby doesn't even have any withdrawal and all those kinds of things. Yeah, absolutely. So know that from an evidentiary standpoint, the evidence is changing, is
Yes.
evolving. And that's particularly the problem here is that we have had major advances, but clinicians are like choosing to not accept it, not even inform themselves. And by the way, that's part of our ethical duties is to keep up with keep up with our specialties. I'm supposed to be doing continuing medical education
Yes,
to
he
know
is.
what's the latest, greatest. So there's two camps, and this is, sorry, I'm taking over, but
You're
this is
good.
one
No, you're
point that
good.
I really struggle with and frustrates me a lot because as a clinician, if you are not listening to this, you're either telling me, one, you don't believe in continuing education and bettering, right? Your understanding of the expertise or the field that you're in, or two, you do, and you're choosing not to.
which is even
You're
worse.
withholding information.
Yes.
Which
Yes.
is you're withholding information, et cetera, et cetera, et cetera. Okay, so why is self-advocacy, right? What a little bit about what it was. Give me a little bit about why do you think it's crucial specifically for mothers or pregnant individuals in recovery? Why is self-advocacy important?
Oh yeah, I'll do it.
Yeah.
I believe it's crucial because it not only affects the mother, it affects the baby as well, and not just short term. It could affect them both long term, and you want to be the best mother that you can be. You want your baby to be healthy, and you want your baby to thrive.
Yes.
So, when you're trying to get prescribed a medication and you don't know what the medication is going to do to you or your baby long term. You know what I mean? Like the whole research and finding out what you're putting into your body to make it the most healthy for you and your baby, I think is a huge thing. When I was pregnant with my daughter, I was prescribed buprenorphine. I'm still on it today, and I think that was the best decision that I have ever made in my life. Not only is my daughter thriving, she's almost 3 now,
She sure
but I'm thriving. This is the longest I've ever been able to have in sobriety, and I feel like that's a success. So
It
I
sure
just,
is.
Yeah, just know know what you want. Like we said, do your research.
Yeah, and it's
truly have
important
to.
to receive the care that you want, the best care
Yes.
there is. So, again, I keep continuing to say, ask those questions because from the beginning, you also want to know, like, how long are you going to be on this medication, and have a plan. Is this a long term, a short term, and have a plan of. Is there a plan of discharge, like if this is, other types of treatment, like residential treatments or anything like that? And don't just go in
blindly. Yeah.
And you're also setting the example for your children and your older children, your
Absolutely.
teens. And hey, self-advocacy, it's important.
It is. It is. So what you're saying, wrapping or just going back to what you said, first, what you need to do to advocate for yourself is to make sure you do your research. And then secondly, is to make sure you ask questions. And I loved how you said, make sure you ask what type of medicines are available, ask how long. I didn't think about asking that, but there are times where you might not need to be on a medication for as long. So knowing how long you're going to be on that medication ahead of time is super smart. I love that.
Yeah.
I wish I would have known this when I was pregnant, because at the time when I was treated with that stigmatized view, I just would leave instead of advocating for myself. And maybe if I knew how to advocate, maybe that little pushback, oh, you may think this about me, but hey, I'm going to advocate for myself to give you a different perspective of who I am. I do really want to change. I do really want to stop using substances. I really want to be the best mother for my child I can be. And knowing this would have truly helped back a couple of years ago, for sure.
Yeah, and you said it. So you said the S word.
Yes. Stigma.
Okay, so a final thought before we sort of move on to, I want to hear what your thoughts are on strategies for effective communication, right? So advocacy is going to be a lot about talking with your clinical, right, professionals and whatnot. But before that, I want to touch on this S word, stigma. Why do I think it's crucial for particularly pregnant and postpartum individuals who are in recovery to advocate for themselves? Because what we see is that they are amongst the most stigmatized and marginalized patient populations. You are a substance user, you go in this trash bin over here. You
You're
are now a pregnant substance user, right? Oh my gosh. Do not pass go directly to jail, okay? Tongue in cheek, right? But that's why I think it's particularly important for this population to advocate for themselves.
No, it
I
is.
could go on ad nauseum as to the horrible practices that I've seen, which is basically clinicians who are treating various disorders find out someone is pregnant and they terminate their care.
Yes, correct.
And my challenge to those clinicians who are thinking about doing this, who are listening, who are viewing, if you're thinking about doing that, just recall that you are doing this, you're terminating care during the single most important period of a person's life.
Yes.
The single most vulnerable period of a person's life. We see this in
Sad.
psychiatry all the time. When someone has a mental health issue, whether it's depression, anxiety, bipolar, PTSD, substance use, pregnancy and postpartum, by far, this is what the evidence shows, is the most tumultuous time. Done deal. And so you're deciding to abandon this person during that time. Just go and sleep at night. What are you doing, right? So that's my call to action for clinicians. Do not do that by no means, no circumstances. At minimum, if you don't want to care for them, transition them to someone else.
Yes.
Just
Yes.
transition them to someone else, okay?
Yes.
I'm off my pedestal again. Let's go with Sam. Strategies for effective communication.
Okay. Yeah. So I don't really have a lot of strategies. What helps me is to write down or like open my notes app in my phone,
Smart.
or in my
Yes.
calendar,
Use your
anywhere.
tools.
Yeah,
Yes.
use your technological tools.
Yes.
They have helped me so much in my recovery. But if that doesn't help you, if you have it written down, but you're still kind of like nervous or don't quite know how to ask it, or really just anxiety ridden, bring somebody with you. Bring
That's
somebody
smart.
that you trust. Bring your mom. Bring your dad. Bring your brother. Bring your partner. And have
Bring your
them.
trusted care manager.
Thank you.
yes.
Bring
I
Evonne.
was
Peer
just-
support
yes.
specialist.
Peer
You
support
you
specialist.
can bring
Yeah.
me too. I mean, I'm not the best, but like I'm better at advocating for a client than I am for myself. So yeah, bring somebody.
That is
And
super
sometimes
smart.
another set of ears, right?
Yes.
I mean, you capture other information, and after your appointment, you may even go over them a
Yeah,
little
you
bit.
can-
It's like,
you
hey,
can go
did you
back and forth with
understand?
each other.
It's like, did you understand this? No, I didn't even hear that part.
Yeah.
I
you know?
love
And
that.
it's like, well, this is what I took from this, and this is what needs to follow up. And also, if you forget anything, if you forget to ask a question, or you think of a new question, hold them accountable. Hold your providers accountable. Like set up a new appointment. Say hey, or call them and say hey, when is there a time that I can speak with someone and make sure I understand this part of my appointment, my last appointment.
Yeah. Love it.
Follow up, follow through, and be clear. Try to speak as clear as possible. And when they're not clear with you, ask them. Can you clarify? Can you simplify?
I love how you said utilize your support, because support is key. I love that, Sam. We really do need an extra set of ears. I know my parents, they always piggyback on each other's doctor's appointments, because sometimes you get that devastating news and you hear nothing but blah, blah,
After
blah,
that.
blah,
Yeah.
blah, 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 blah.
That's it.
And you need that extra set of ears to say, this is what you missed. Or you just need that person to be there to console you, to help you process certain things. I'm thinking maybe if when I was pregnant and had that OBGYN appointment where it was horrible. She made me feel like dust. But maybe if I had someone there who could have actually been there to kind of help me process my feelings, and maybe they could have either helped advocate for me, or maybe they could have pumped me up to, hey, no, you're not going to take that. You're better than that. Don't listen to her. And you need to advocate for yourself now. And maybe that could have been different. So I love how you said utilize your support.
Also, I'm just going to use myself as an example. And it's not about medical, but, when I was about to be discharged from rehab, and I was looking for temporary housing, and, I didn't have a job. I had just had my baby, and I was trying to call places to get updates on the lists that I'm on, and this is right when I became a client at Empowered. A lot of people, or a lot of organizations, or healthcare, they would rather conversate with somebody else that has a title as well. So bringing unfortunately,
because they're not just working with the other.
More respect to
it does.
They do. Their tone changes. Completely.
I've experienced that myself.
So so that bring somebody with a title.
Yeah.
And it shouldn't have to be that way.
No,
it should not have to be that way.
And
sometimes,
and a lot of times when I meet with patients and participants of the Empowered program, we're discussing a situation. She's like, well, I have to visit this organization, I have to ask this, and I'll give them a resource, and sometimes I'm coaching hey, this is how you're going to ask. You're going to go in there this is the need. Don't talk about this other stuff that's happening over here, because they're, sometimes I know time is limited. They do have other cases, and they might be short with you, but what are we trying to get, right? We're going in there, we're trying to get some results, we're trying to get some answers. So you're going to ask this way or ask this certain question. Let's write that down. And if that doesn't work, then this is what we're going to do. And last resort, and I want them to try it first, because again, you're not always going to have
someone there, talk for you,
someone available all the time. But last resort will be, it's okay, if all fails, come to me, and then I'll try and call me. I'll show up. I'll send Sam. I'll send Quinny. But someone will be there, and you're right. It does change when someone else in the field or with a title advocates for them. But it shouldn't be that way. And I do always encourage that they first try. That they first try. And a lot of times, well, not a lot of times, but the times that you want them, it will happen, and it will. They do get their answers, but try it, and then if not,
don't
back
give
up.
Don't give up.
Don't give
Call
up.
back up.
Perseverance.
Yeah, a lot of things that we bring up during these podcasts could be episodes of their own, right?
It really
a lot of eye rolls.
So this little tidbit that we're talking about, which effective communication strategies, again, could be a whole podcast, could be a whole series of its own. I'd like to say that I think in healthcare, we are moving in this direction, but currently, as it stands now, we are not good at this. And that is practicing what we call trauma-informed care.
Yes.
Which isn't something that I'm trying to say is judgmental or assuming that everyone has had a traumatic event or that's the reason for this or that, but it's just practices that work well in all for those that haven't either. But trauma-informed care, why is that important? Why do I think that can be an effective strategy? Because if clinicians are always viewing folks as, I'm not taking anything personally, everything that's happening in this interaction is somewhat based off of this person's experience in the past, I can hopefully reduce some of that bias, reduce some of that stigma, reduce some of that judgment, and express more empathy, right?
That is so true.
I'll give you an example. Some of our folks, some of our patients and clients have had, horrendous experiences in their lives, right?
Yes.
And so when I might approach them in a situation, for example, they're coming into labor and delivery and they're in labor, okay? And I am a guy. I'm a male.
Correct.
I come busting on in and they're alone. And I'm asking them questions, just everything about my mannerisms, my voice, the way I look, the fact that they're alone, all of this can be absolutely triggering.
Yes.
Okay.
Yes.
But if I'm not practicing trauma-informed care, I might not tune into that. And so when I say, have you been using substances like that, that individual might be flashing back to a time when, unfortunately, they were sexually assaulted.
Yes.
Okay. And now their response to me is not, yes, and let me tell you why. It's, get out. Right?
Yeah.
Clinicians are going to jump to the conclusion, oh, here we go, difficult patient,
Yeah.
Mentally
this, I want to
unstable.
judge you,
Unstable,
mentally
yeah.
unstable.
Probably is you.
Probably under the
All those
influence.
kinds of things. Okay, all right. So if that's sort of the baseline, even though the onus is on us to practice trauma-informed care, we might not be the best at it.
Yeah.
So on the patient side of things, and we're talking about pregnant individuals, postpartum individuals, where you talk about stigma being super high, as much as you can, try to sort of practice wise mind-ish,
Yes.
which means I'm not super emotionally charged and I'm not super checked out. Logical is the real thing, but in the middle. Something like, oh my gosh, I know this is super traumatizing. I want to yell and I need to, and I know that this might not be possible. Absolutely, I can appreciate that. But as much as you can, trying to keep that sort of cool head to say, I am really struggling right now. I am here for your help. I need your help, and this is why.
Right.
Yes.
Right? And how I sort of tell clinicians is, don't think what's wrong with this person. Try to think what happened to this person.
That's perfect.
Right. So there's some, that's what I would say for effective. That's just one little tidbits.
And it's okay to say when you're uncomfortable.
It is.
It's okay to
and
say,
all of it is
you know what?
uncomfortable. You're still going to get judged, or you still might get judged, and all those kinds of things.
Yeah.
But trying to approach it sort of from this person is uninformed, this clinician is uninformed, they don't know my story, and so I'm going to try to take that different approach as best as I can. Okay.
Yeah.
Obviously, like I said, we could go on forever and ever, but what about building your advocacy tool? So we talked about what advocacy is. We talked about maybe some effective strategies for communication. So what are some things that you can put in your toolkit for our viewers and listeners? Evonne.
Let's see. I'd say definitely have like the information and written down. Have your contacts also, and who do you trust and can call at the moment to talk it through, or even if you have to make a phone call during the appointment, have that in your toolbox. It's like, who would I call?
Yeah.
Who would I call at that moment if I don't understand? And I guess like I said, just have it in your toolbox a little bit behind, like maybe a little bit of that research and, your phone fully charged, if you need to look something up. And also understand there is alternatives, right? Go in there knowing there's alternatives. and that you can request to meet with other providers.
Yeah, second. I was just thinking about that. Second opinion.
Second opinions, other providers. You don't feel comfortable, and I speak this about like participants who go and need to meet with certain for psych services with certain psychiatrists. We have our clinician at Empower sometimes join these first or initial assessments, and it's like, hey, you know what, this psych doctor, wasn't good for me. It's like that. I didn't connect. I didn't feel like, or the therapist, right? I didn't feel like I can say anything to the therapist. Like, well, sometimes it takes one or two, it takes more than just one meeting,
yes,
right? To develop that rapport with your therapist. But if it doesn't, right, a few times meeting in, hey, like, you know what, I'm gonna go and grocery shop, right? I'm going to go in and look for someone else and meet someone else. You have to feel comfortable. That doesn't mean because you went in, you did the initial assessment, and now you've met them 3 times that you have to continue meeting with them.
It's kind of like dating.
It's kind of like dating, but it also doesn't mean that you no longer seek therapy.
Yes. Shop around.
So definitely in your toolbox, there's more. There's options. You have options.
There's more. I like it.
I love that.
Yeah, and just breathe. I would say just breathe and breathe. Don't forget to breathe. when you're in there and you're talking to your doctor, just like right now, like I'm so nervous. And I'm nervous with every interaction that I pretty much do. So you just got to remember to breathe. Take big deep breaths, guys.
Hey, they're people too.
Yeah,
yes, they are.
They are, even though some of them might have judgments about, your condition or, whatever. They're people. I'm sure, you have judgments about other things too. I mean, we shouldn't. We absolutely shouldn't. But, they are just people.
Oh, one last thing. Document. They document. Healthcare providers will document.
Oh, yeah.
You document too.
Yes,
because
that's a great factor.
Get your medical records.
Get your medical. Request them.
Yes.
Get them.
They have to give it to you.
Write down the date, and I say write down because that works for me.
Yeah.
I don't rely again purely on my memory, so I'll write it down. But I write down. When did I go in? When was my visit? Or I have it on my calendar. I wrote down who I spoke with, because in my next visit, when I say they told me, I don't want someone to ask me who is they,
and you don't know,
and not know. Well, they, because then it looks like, oh, I just made that up. Well, you know what? I didn't. I have names. I have names of who I spoke to in my last visit, and we went over this, and this, and in this visit we're supposed to go over this, and this. Put it on them a little bit.
Yeah.
Hold them accountable.
It's so funny you mention that because both of my parents do. My dad actually does the spiral notebook, and he has a spiral notebook with all the appointments, who he spoke to, what time he went in. It is all documented. My mom, she has it in her phone, and she's quick to pull it out. What about this? We were supposed to go over this. I love it. And it's so true. You do have to document things. And also, why not document about your experience, too,
Right.
Yeah.
I just want to say one more thing. I just want to say, try to get comfortable with it, because if you're a mother, your kid's gonna be in daycare, your kid's gonna be in school one day, and you're gonna have to advocate for them too.
Yes.
With their healthcare provider, with their dentist, with their school, and not everything's gonna be, A1. It's
not at all.
You gotta get comfortable with telling people what you want
and what they need. Because they can't advocate for themselves.
No,
Yes.
Like my daughter can't even talk right now, and if she comes home with something from daycare, like a bruise or something like that, she's not going to tell them off. I have to.
Exactly. My daughter might try, but we're not going to really understand what she's saying.
Yeah, she talks a little bit, but you know what I mean? I'm gonna have to be the one to take her to the doctor to go get it checked out, or
That is so true.
Just try to get comfortable with speaking up for yourself.
And then we can help write a really strongly worded email, and
we can write a letter.
Write a really, if that's easier for you.
Details. That's why it's important to document.
It's important to document, and it's also important to ask when they're explaining everything that's happening in your appointment, to say, hey, is this going to be an email? Are you going to send this information in email that you can later review? And if they say, no, I wasn't thinking that. It's like, well, can you? You know, can you write this up? Can you summarize this? Or can you give me, sometimes they'll give you like printouts, but it's like, you know what, I prefer it in an email because at least it's there and you can go back
Love
to it. A
it.
little printout, sometimes you'll lose.
The paper
you'll throw,
trace.
You'll throw away. It'll fly away after your appointment.
Clutter.
You know, it's clutter. You know, we don't know where we put them. So yeah.
Absolutely.
So
Absolutely love it.
anything to add before I
You know what?
kinda
These young
talk
ladies
about my
took it
toolkit?
away.
Yeah.
They
Yeah.
are phenomenal at
Yes.
what they do. They equipped my tool belt. So
This
true.
will come up. This will probably come up again. But Batman, you got to be like Batman with your
Yes.
tool belt
Dear
that
Lord.
has just something for everything. I
Something
need
for everything.
smoke.
Yes.
I need this grappling hook. I need this bulletproof thing. Yeah, totally.
Yes, that used to be my favorite superhero.
You all have actually touched on a couple points that I think are very applicable, and I'm going to add to those in regards to what are something that patients can put into their toolkit. Keyword: informed consent.
Yes.
Okay.
Yes.
Informed consent. Write that down. Put it in quotes.
Oh, yeah. No, you're right.
These two words hold a lot of power, and from a clinician side of things, it is my medico-ethical, legal duty and responsibility to perform proper and complete informed consent. Long story short, what does that mean? It means for everything that I'm planning on doing, everything that I'm planning on recommending, I have to, a few things. I have to talk and tell you about and educate you about the risks, the benefits,
Yes.
the side effects, we'll call those sort of risks,
Yes.
the alternatives,
Correct.
and then also no treatment.
Yes.
Okay, so those four things, the four major things: risks, benefits, alternatives, and no treatment. Okay? Using that in the context of Evonne, what you had mentioned and what I had mentioned, this whole medications for opioid use disorder and people only being told about methadone.
Correct.
Now, all of a sudden, you can see the violations that are occurring, right? So I need to tell you the risks about methadone, things like significant risk for neonatal abstinence withdrawal syndrome.
Yes.
The benefits, clear and done. It's a life-saving medication, absolutely. So the benefits we know, right? Alternatives, there's two other medications called buprenorphine and naltrexone that I need to talk to you about, and then no treatment, right? So as we can see in that particular example, one of those is being violated. Alternatives are not being properly discussed with our patients, right? So ask your clinician about this.
Yeah.
Say, hey, are you giving me proper informed consent on this treatment recommendation?
That's right.
I've heard
And
about
look at
the
their face
That
fall.
is-
Watch 'em
for
pick it
real,
up.
for real. Bring on the hate mail and the hate
They're like,
comments.
oh no,
It's
she knows her stuff.
It's going to
Oh,
happen.
no.
But a lot of people talk about the benefits, but they don't talk about the risks. Look, that is so much of a reason. It's a big reason as to why our healthcare system and clinicians got us into this opioid epidemic issue, because we
first
talked
place,
about the
yeah.
benefits, which were pain relief and you're going to feel great and absolutely
Non-addictive.
but
yeah.
where were the risks? Where was the conversation of the risk? Hey, after about 7 days, you have 125 times more likely to develop a use disorder. What? You just wrote me a 30-day script.
Yeah,
for
correct.
a
No.
scrape I got on my elbow.
Dang.
Right? Absolutely. Right? So don't assume it's going to happen.
No, you're right.
And if it doesn't happen, it's an obligation. They might, if a patient told me that, I would be like high-fiving the patient for being informed and calling me out on an informed consent. I happen to do it because it's just part of my practice. And that's how I was trained. But I know that it doesn't happen.
I'm going to be honest with you, Dr. Farzad. Even before I suffered with substance use disorder, I never had a doctor do all that for me, not go over all those different aspects.
Right.
They would usually tell you, I know that my job was, as soon as I got my prescription, I would look at the side effects to see if that was something. But of course, it's too late. Then I'm going to have to go back to the doctor.
Well, yeah, but your whole treatment plan is based off of this.
Exactly.
Yeah.
And so I know that they wouldn't go over risk, which are super important. They would find out what other medications I'm taking. But other than that, it was like, oh, this is what's wrong with you. I'm going to give you this. You take this for this long.
Have a good day.
Yeah, and come back and see me in 2 weeks.
Right.
I felt like I was getting co-paid to death.
Go
You
get to
know?
that. Yeah, right. So
It was horrible.
Here's something I'm going to go out on a limb for. I'm going to go out on a limb on a few things here. And one of them is tell your clinician about informed consent, the requirements for informed consent. And if you get a negative response, I would say just move
Yes.
on.
Yeah,
Find a different
that's
doctor.
great.
Move on.
Yeah.
Move on. It's
Great advice.
It's move on. If you're not a clinician in this day and age
Like,
who's
how can I-
willing to do this,
How can
Next.
I trust you with my
That-
care?
how about
that,
this?
you know,
How about this?
really.
I wouldn't want to see that clinician. I would move on. You all do what you want with that information.
Yeah.
Okay,
Love
point
it.
two. Point two is we have this notion in medicine called evidence-based guideline recommendations, best practices, standards of care, goes by different, right, names. But you start to throw some of those out. Is your recommendation an evidence-based best practice? Is this a guideline recommendation? Is this the standard of care? And that's kind of like saying the whole informed consent thing. You
that's
say something
correct.
like that, and someone's going to, oh, okay. I'll give you an example. Again, we've been spending a lot of time doing education as part of, perinatal efforts at the state level here in Nevada, because there's several different associations. We know the CDC, we know SAMHSA, right? CDC Center for Disease Control and Prevention. But there's the American Society of Addiction Medicine. There's the American Psychiatric Association. There's the American College or Congress of Obstetrics and Gynecologists, known as ACOG. There's the American Society of Maternal Fetal Medicine. Society for Maternal Fetal Medicine, which is SMFM. And then let's throw in the United States Preventative Service Task Force, okay? All of these major societies that guide our specialty practices have recommended universal screening for pregnant and postpartum individuals, okay? Universal screening. And what they particularly say is that screening is questions and do not do urine drug test. They say do not do urine drug testing. Yes, viewers and listeners, you heard me get really loud there. And what do we find in our communities? Most people are doing urine drug testing,
Yes.
and most
Correct.
people are not asking questions. This
Yeah.
is going against all of those recommendations, okay? So for our viewers and listeners, if you come across someone like this, you throw out some of these keywords like, is this what ACOG recommends? Is this what ACOG
love
recommends?
it.
Isn't
Love
like
it.
UAs like the first thing that you do when you go see a doctor?
That's what
Especially
I
when you're
thought.
pregnant, right?
Yeah,
Yes.
so a little bit about that.
What do you mean by that?
Yeah.
I was
So-
curious,
So
too.
so a UA, which is a urine analysis, and they're looking for things like protein and sugar in your blood,
Yeah.
infections in your blood. But a urine drug test is a different test.
Right.
Gotcha.
And that is where they're looking for, who knows? Because a lot of clinicians don't even know what they're looking for. They click a
They
button
just-
on some order,
Yeah.
and then I ask them, I say, what are you testing for? Tell me what substances you're testing for. Blank stare. Blank stare. And I promise you that if you're giving proper informed consent, which you're required to for our viewers and listeners, this was a case that went to the Supreme Court because a pregnant individual was tested. There was ramifications. The Supreme Court found that that was a Fourth Amendment violation.
Oh, wow.
So to
Wow.
get a
Sounds
urine
like
drug
that.
test
Yeah.
completed on you without your proper, explicit, informed consent is a Fourth Amendment constitutional right violation. Good luck, clinicians, and there are active lawsuits for this specifically. Okay, but there you go. Just mention that.
Thank
We're
you.
running out of time.
Thank you.
Definitely another
Mention
thing
that
to put in your
because-
toolbox.
That part right there.
Yeah,
Yes,
that part
add
right there.
those things.
That part right there.
And that's what you should be, reading up on the web. Stuff like that.
Yes.
right.
And don't
Okay.
just sign, read.
Yeah, no, you
Read.
do have
So-
to read what you sign. You do have to read exactly
Yeah.
what you're signing. And if you don't feel like reading, ask them to explain it to you.
Totally. Yeah.
Yes.
When I say explicit informed consent, particularly around this, it's not just you're signing something on a piece of paper. It's I'm also having a conversation with you
Yes.
to go over risks, benefits,
Alternative?
alternatives, and no.
Simple.
and
No.
no,
No treatment.
No
And
treatment.
No
and then
treatment,
this
yes.
is where a lot of folks get into trouble. I say, okay, so if you're testing this individual, is that reportable to CPS? Is it reportable to their respective licensing authority? You said this person is a bus driver. Is it reportable to
Their
the
job.
commercial? Is it reportable to job? And if the clinician cannot answer that, that by default means that they weren't able to give informed consent.
Wow.
Violation.
Violation.
These are just minimal examples. Guys, Thank you so much. I've taken over most of this. I apologize
You're
for
good.
that.
No. It's part of the education.
We want to thank both of you for
Thank
being
you.
here.
Thank you, Evonne.
Invaluable.
Thank you,
We could
Sam.
go on forever.
I just love that I could spark the conversation.
Spark
I
the
love hearing you
conversation.
too.
We should have,
No, you were
further
amazing.
episodes about topics like this. But
Yes,
thank
because
you
this
for
is
being here.
Super important.
And to our viewers and listeners, thank you for listening or watching this episode of Empowered Voices. Be sure to subscribe wherever you get your podcasts, as another episode will drop in about 2 weeks. We release them every 2 weeks or
Yes.
so. Also, don't forget to rate and share with others who may find our information discussion topics helpful. And lastly, if you have a recovery-related topic you'd like for us to cover in future
Yes.
episodes, visit empoweredmoms.org/podcast to submit your ideas.
Awesome.
Yay.
We're here for
you.
Thank you for watching and listening. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or in Lyon County in Northern Nevada, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. Again, empoweredmoms.org. If you live outside of these areas, we really encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrea Peterson and Jason Roth, with production assistance by Rachel Mack. Writing assistance by Troy Stefano. Recorded at the Video Podcast Studio at Canico Media in Las Vegas, Nevada. For information about this podcast and past and future episodes, visit empoweredmoms.org.